And we begin here at 4 o'clock with breaking news. President Donald Trump making a major announcement just moments ago, linking the development of autism in children with use of the pain reliever Tylenol during pregnancy.
First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism. So taking Tylenol is not good.
So today we looked into research that's been done in recent years about the risks of using acetaminophen during pregnancy. Charlie Wojciechowski is here in the studio with that part of the story. Charlie?
Well, Kate, acetaminophen, which is also known by its trade name Tylenol or paracetamol, is one of the most used painkillers in the United States. It's also in a number of other medications, including brand names such as Alka-Seltzer Plus, Comtrex, Drixoral, Excedrin Migraine, Midol, Sinutab, Sudafed, Theraflu, and Vanquish. It's been in use since 1960, and most doctors still recommend it, but they say more research is necessary. Is acetaminophen a trusted painkiller or a dangerous drug for women who are pregnant?
I don't want to spread fears. I also don't think we have the knowledge that we need to make any changes in policy.
Dr. Karim Radwan is the director of the Neurodevelopment Clinic at UChicago Medicine. He says no credible research suggests a link between acetaminophen and autism.
Based on what we know right now, there's no clear evidence that will support causation at any level.
Other researchers agree. A study published in the January 2024 issue of the Journal of the American Medical Association found that acetaminophen use during pregnancy was not associated with children's risk of autism, attention deficit hyperactivity disorder, or ADHD, or intellectual disability. The Society for Maternal Fetal Medicine says studies so far are simply inconclusive. And the American College of Obstetricians and Gynecologists says acetaminophen remains a safe and trusted option for pain relief during pregnancy. Pregnant patients, it says, should not be frightened away from the many benefits of acetaminophen, which is safe and one of the few options pregnant people have for pain relief. But at least one new study from the dean of Harvard School of Public Health says acetaminophen use by a pregnant mother may increase the child's risk of autism or ADHD. Radwan advises caution.
Knowing that acetaminophen is safe and often the only safe choice that they have if they want to treat fever, and if somebody is choosing not to treat their fever because of their fear, that could have consequences as well.
Now, Radwan says his advice to patients has not changed. If you have a fever or other good reason to take an over-the-counter medication like acetaminophen, it is okay. But if your condition does not improve, he says it's important to see your healthcare provider, who can better diagnose what's wrong and then prescribe what is necessary to treat it. Kate and Stephan.
Are doctors worried at all that this policy change will have negative consequences for pregnant women?
Well, they are, because a couple of things are going on here. First, Radwan says a link between autism and acetaminophen can be misleading. Is it a link between the drug and the condition, or is it the mother's underlying reason for taking the drug that is causing the condition? And at this point, researchers really don't know.